Hi everyone, I'm here with Dr. Ron Blankstein. He needs no introduction. He's our SCCT President-elect and the chair of this year's SCCT 2019. And we are speaking live from SCCT 2019. As part of the first committee and as part of being a member of the committee, I have certain questions that I would like to ask Dr. Blankstein, and I thank him for joining us today.
Thank you, Nidhi. Thanks for taking the time to interview me.
Absolutely. First, Dr. Blankstein, if you could tell us briefly about how you got involved in the field of cardiac CT. I'm sure a lot of our fellows and early career members would want to hear that from you.
Sure. I got involved approximately 15 years ago. I was a fellow in Chicago at the time, and I heard about this new test that was just getting kind of more recognized, which was cardiac CT. Fortunately, I had very good training in echocardiography and nuclear cardiology, so I already had a lot of interest in imaging in general. And then I wanted to have some exposure to cardiac CT. And then the Midwest, the largest program at that time was at William Beaumont, where Gil Raff, one of the recipients of this year's Gold Medal Award, was very active in cardiac CT. So I decided to make the drive from Chicago to Beaumont in Michigan and got some exposure during a 2-week rotation. And right away I thought this is a really special modality. This is something that I want to invest more time to train in. So following my cardiology fellowship at University of Chicago, I decided to do an advanced imaging fellowship, and I went to Mass General Hospital in Boston, where there was a robust cardiac CT program at that time that was started by Tom Brady. So that's how I got involved.
Excellent. And now, since we are at the SCCT 2019, we would also like to know about your insights from the meeting, and tell us all you can about our this year's meeting.
Yeah, well, it's been a really exciting meeting so far. In fact, it's the largest SCCT meeting we have ever held in terms of the number of people who have attended this. And it's a very exciting meeting. In fact, during the opening plenary, I compared the program that we have this year to the program from 10 years ago that I had a chance to recently review. And there's many aspects of cardiac CT, or many words that weren't even in our vocabulary 10 years ago. So 10 years ago, words like TAVR or TMVR or CTFFR or machine learning or even prevention really weren't part of the meeting at all. So today's meeting has so much to offer people of every level, and specifically when we designed the meeting, we wanted to have something for everyone. So whether you're a fellow in training or an early career person or someone who just is trying to learn the nuts and bolts of cardiac CT, we wanted to make sure that there's plenty of sessions for that. And then individuals who are advanced users, they want to learn about things like machine learning or advanced plaque quantification. We have sessions on that. Many individuals are interested in structural heart disease, and we have a lot of offerings this year about use of CT for TAVR and TMVR. We wanted to make sure that people who use CT for various niche indications will be able to get that education at the meeting. So there's sessions on how we use CT for electrophysiology planning. We had wonderful talks this morning from some of the world leading electrophysiologists on how we use CT for VT ablation or prior to other EP procedures. We have talks about how to use CT for cardiomyopathy, which is also a really big area of what's the role of CT in conditions like ARVC or to evaluate cardiac masses. And then, of course, CT and prevention is a very big theme for us. We had a dedicated session on prevention where we talked about use of both calcium scoring and CT angiography to enhance prevention. We had a wonderful talk by Arthur Agatston himself giving us some novel insights into prevention. We had the Agatston Prevention Award recipient, Roger Blumenthal, give us some wonderful talks as well. And in addition to that, we had a dedicated session on calcium scoring, which was very well attended, particularly now that calcium scoring is in the guideline. There's a lot of interest in calcium scoring. How do we implement that into practice, and what are the current barriers? I can keep on going. I'll say another topic that a lot of people wanted to do when we created this meeting was to make sure it's a social and fun meeting for everyone, and I hope it has been for you and for the rest of the fellows in training.
Absolutely. Tell us a little bit more about the social aspect, because I've seen a lot of social media engagement and everyone's following even remotely and here. It's been wonderful to see such a tremendous involvement.
Yeah. Well, the social aspect, I think, is one of the most important aspects for people going to a meeting. And in fact, for all the early career and fellows watching this, I always encourage people, when you go to a meeting, make sure that you interact with others. Sometimes the networks and the connections that you make with people may be the most important part of a meeting. So with that in mind, we created a lot of different receptions, reception for women in CT, a reception for early career members. We had an international reception. We have various fun learning programs such as Jeopardy, which we've always had, Team Spirit, which is always one of the highlights, led by Stefan Achenbach. And this year, even a vascular game show called Kahoot that one of my colleagues, Mike Steigner, is leading. And people really like these because these are sessions that are a little bit more laid back. They're fun, but yet you get something out of them and you have an opportunity to interact with others. You mentioned social media, and that was a very popular aspect of our meeting. In fact, we had, as you know, a social media symposium that was very well attended, which both educated people about some of the ways how social media can enhance the cardiac CT education experience, but also things like how to tweet. We have people that actually wanted to come to this meeting and say, social media is wonderful, but I want to learn more about it. And this is one of those areas that actually the younger generation can teach a lot of the more seasoned folks, should we say. So that was a popular aspect. FSCCT as a society is actually really leading the way in social media activities of all the imaging societies. I think we're one of the more active societies on social media. And we view it as a way to really get the message of what happens inside the walls of this meeting and get it out to people outside. We think that the impact of this meeting will be well beyond just what happens in these walls. And we're already getting a really impressive audience outside that's actually interacting with our meeting, that's providing comments. In fact, just on the first day of the meeting, we had over 10 million impressions on social media, and that's just for the first day of the meeting. So you're exactly right. That's been an important area.
Absolutely, and it's been remarkable to see everyone's involvement, especially here as well as social media. I think a lot of folks are well engaged with the meeting throughout. One more question I had was regarding our fellows in training and early career members. As you mentioned, that they are very important and their engagement has been very important to you. So my question is, how would you, as FSCCT incoming president and from the society, what is FSCCT doing for the fellows and our early career members to get that across to them?
Well, first of all, we want as many early career members and fellows in training to attend our meetings. So, of course, if you did not make it to this meeting, there's always next year, which will be in Seattle. I always tell fellows it's a wonderful experience to be able to attend, especially smaller society meetings such as this one. But on a day-to-day basis, there's a lot of other things that can be done. For some fellows, it's just being engaged through social media, which is one way to contribute. For other fellows, if you're really interested in being part of the society, we do have a committee, which of course you know because you're part of it, which is the first committee. And this is a committee that we specifically designate for people that we identify as future leaders of the society. So the first leadership committee is one that you need to apply to. But the problem that we have had actually is that it's been such a popular committee is that we received way more applications of very qualified people that we had to turn away. And in fact, it's a good problem to have as a society because a lot of early career people are interested in this committee and interested in being part of the society. So in response to that, what we decided to do is to actually grow the first committee, and there's going to be a first at-large committee where we decided that we are not going to turn away any fellows who want to be part of this committee. If anyone wants to be part of the first at-large committee, we will make sure that they are members of the committee, and by being part of this committee, they will automatically receive communications from FSCCT and automatically will be part of our community. But within that committee, we will still have the selective process and the more competitive process of individuals that we will identify as future leaders, where for us as a society, we will try to groom and grow those leaders, people just like yourself, and hopefully for us, make sure that these leaders not just serve in this important committee, but also when they leave the committee, that they can grow when they're early in their career to become future leaders of the society. I think I will add, Wiz, that something that is very important for us is to also grow more women leaders within FSCCT. I think in general in the field of cardiology, as you're well aware, we have a shortage of women in women in leadership positions, and that is something that we are actively working to address to the extent that we're able to.
Excellent. I think that's very important, and I'm sure all our fellows and early career members would be happy to join us. And speaking from the first, being part of the first committee and speaking on their behalf, I'm sure that I've seen a lot of engagement and interest from all the fellows and early career members, and myself have learned a lot from all the leaders in the field, including yourself, and have had the opportunities of working with you and knowing you. So I'm very thankful for all your efforts in this direction.
Absolutely, and I think it's always something, it's a two-way street. Myself, I've learned a lot from you, from some of our work together, and a lot of the good ideas that come into society sometimes come from folks at all different levels, so sometimes there's this perception that you may not be able to offer a lot because you're early in your career, but some of the best ideas, and in fact things that we have implemented here at this meeting, were ideas that came from some of the fellows in training and some of the early career individuals. So I think it's always important to speak up and try to be as active and contribute as much as you can.
That's great, and I'm happy that all our fellows and early career members would be interested in knowing this. One last thing would be to your one advice going forward for our early career members who are interested in imaging and fellows who are going into imaging.
Well, I always say when you're training is whatever you decide to do, for many people it's just multimodality imaging, or whether it's cardiac CT, you want to be really good at what you do. So especially during your training period, if that one thing is cardiac CT, get exposed to as many cases as possible, always trying to correlate the findings of cardiac CT with other modalities, whether it's nuclear imaging or invasive angiography. Be an active learner, always read, be familiar with the literature, and try to soak as much as you can during your training period, because it will define for the rest of your career your knowledge and your skill set. And of course, while you do it all, try to also have some fun.
Thank you so much, Dr. Blankstein, for joining us today.
It's my pleasure.
We've enjoyed this meeting so far really well, and thank you for all the efforts.
Thank you, Nidhi.